Oh, Jessica, can you hear me?
Yes, read you loud and clear.
Okay. Okay. I am Lisa Dixon Gray. I work I work for the state. I'm in the Oregon Health Authority in the Public Health Division and the Maternal and Child Health section. And within all of that is Oregon Mother's Care. And I have been coordinating OMC now since about 2011. I wear some other hats in maternal and child health and do some other policy work. But my big focus and my love is OMC and making sure pregnant women get off to a good, healthy start. So I am here to talk about OMC, and I'm going to address who we are, what we do, how we do it, why it's important, and where we are, and not necessarily in that order. So, who we are. OMC has been around since 2000, so about 18 years. And we started off small, but we started off with a strong relationship with Oregon Health Plan staff. So since 2000, we have been doing OHP enrollment assistance as part of what we do, because our big focus is we want to ensure access to prenatal care for pregnant women. And in 2000, pregnant women weren't getting easy early access, and we define that as at least one visit in the first trimester of pregnancy. And so in order to get early access, you have to get many women enrolled into health insurance, OHP. And so that was always from the beginning a focus of what we did. But we also knew that it was important to provide referral resources to pregnant women, getting them things like access to home visiting services or dental services or tobacco cessation. And so we do that as well. We then also provide pregnant women with educational information about being pregnant and what they need to do, what they need to look out for, and what they can expect. So again, our big goal is to ensure that pregnant women get access to prenatal care within the first trimester of pregnancy. And we're not the only program or the only entity to have that as a benchmark or performance measure. Many public health departments have that performance measure. Providers who especially work with pregnant women want to see women early, not later. And all of the CCOs have access to prenatal care within the first trimester as an incentive measure. So doing this is a pretty common thing for entities that work with pregnant women throughout the state. And so our goal is 90% of all of our clients will get that early access within the first trimester. And in 2017, we hit 89%. We have gotten as high as 93%, and we'd love to get to 100%, although that gets pretty difficult. The other important thing is for women who come in to see us after that first trimester, we want to hustle. We want to make sure that they get a provider visit within 2 weeks after we see them the first time. So that means if we're also doing OHP enrollment assistance, it becomes pretty crucial to move fast so that we can make sure that women get that prenatal visit within that second or third trimester as quickly as possible. So where are we located? OMC is not in every county. We're in 24 counties, mostly in public health departments. We're also in a few medical clinics, healthcare clinics, and in at least one hospital in Lynn County. So we're spread across the state. We have a website, healthoregon.org, OMC, and as I said before, we're in the maternal and child health section in the public health division. So we administer it from our Portland office, but then public health departments, clinics, and hospitals have their own OMC staff who run the program, who make appointments with women. Women come in, they apply for OHP or a QHP, and then from there, the OMC worker will also help arrange prenatal care plus other services. So in Portland, this is the building where we're located in. If you've ever ridden down I-84 in Portland, you've passed our building. I call it the Skeleton Dome building. And we are located between the Lloyd Center Mall and the Convention Center. But again, we have those 24 other sites. And here is a picture of where we are located. Now, all of those counties that don't have a star, that doesn't mean that they can't get assistance. It does mean, though, that a woman might have to try and obtain assistance from an OMC worker telephonically, and that OMC worker might have to refer them to a OHP community partner within their local county. So OMC will see women cross-county, and that's fine, and they expect it, and they've been trained to do that. So I talked about the fact that we have staff in 24 counties. I like to think of us as the front door for all pregnancy resources. And I don't know how many of you out there have either been pregnant or have had a spouse who's been pregnant or a sibling. But that first pregnancy usually comes with, oh my gosh, I'm pregnant, now what do I do? And people become very attentive, women become very attentive. They then want to start thinking about what's that next step. And so I like to say that OMC is that front door. We can arrange and promote and help with that next step. And one of the steps is early access to prenatal care. But then there are so many other things that can be done. So OMC can refer to pregnancy testing. As I said before, OHP and QHP, we will connect women to dental care, WIC, home visiting, and lots of other referrals to services. So here's sort of a jumbled list of what of the work that we do. So we will do screening. We will, for things like intimate partner violence or tobacco use or alcohol use, we will make referrals and sometimes enroll people within WIC, depending on the county. We will make referrals for home visiting. We'll help people get transportation. We'll talk to people about setting up some sort of child care after birth. So there's a lot we do. Here's a little bit more, less artsy but more understandable list. And while our big measure is prenatal care, both with selecting, scheduling, and then confirming those appointments. There's a big list of what we do too. And sometimes we get women in who've been pregnant before and say, I already have a prenatal care provider. I don't need that, but I need help getting onto OHP, or I need help getting into getting a dentist, and then we can supplement that prenatal care provider. Or we have women who may come in just for OHP or already have OHP and are referred by one of y'all, but don't have the rest of the things on this list. And we can do that. So this brochure is hanging out in and around counties in those 24 counties. And these are the brochures that we like to have in communities so that women can contact OMC. Now, one of the ways that women can get in touch with OMC is from 211 info. And Jessica, has there already been a 211 info presentation?
Yes, there has.
Yeah. So 211 info is funded by a bunch of different funding sources, but the same entity that funds OMC also provides funding to 211, so that 211 will also make those referrals to OMC. So there's lots of nice connections to get to us. One of the requirements for our OMC staff is that they also be OHP community partner enrollment assisters. So during all of the transition, we made sure that our staff got trained and their organizations applied and that they became certified enrollment assisters. So all of our OMC staff across the state are assisters, or if they're not, there is an assister in the cube right next door, office right next door, and that they know how to work with that assister. So we do keep track of our clients who come in and what they ask. Getting OHP is kind of one part of that three-legged stool of services for OMC. So our OMC clients, about a third of them who come in either have no insurance or they're insured in a plan that doesn't provide maternity care coverage. So they need to apply for something else. So that's pretty much the first thing that many of our OMC staff will do. But we also then have almost another third who, when they come in the door, they already have OHP. And from there, what we do is really focus on the prenatal care assistance, getting them WIC, getting them home visiting, smoking cessation, dental care, that kind of thing. So as I said, we've been working with OHP since 2000. All of our OMC sites have a community partner enrollment assister available to them, or they are enrollment assisters. About 6% of our clients are referred to other community partners in their community. So something happens, somebody's out, and a client will get referred to one of y'all. But our pregnant women, we know we don't see 100% of all Oregon Health Plan pregnant women. So we know that pregnant women are seeking Oregon Health Plan from many of you. And what we would like to ask is that if you are enrolling a pregnant woman into OHP, that you then, as a second step, send her our way. And then we can go ahead and arrange for her to get prenatal care. We can enroll her or refer her to get enrolled into WIC. We can then start working on dental care for her. We can refer her to home visiting and all of those other services. There are some bumps sometimes for a pregnant woman to be able to get in to see a provider. I know that OHP rules allow retroactive coverage, so that when someone applies for OHP, they are then allowed to seek out health care, and if they are determined eligible, they will be covered for the cost of that health care. However, we also know that our experience has been is that in some counties, depending on the provider, they may not allow a woman to make an appointment until after she shows up in the MMIS system and it's confirmed that she's actually a OHP member who has been determined eligible. So that sometimes makes it a little bit harder and makes it take a little bit longer for a woman to obtain prenatal care. And so that, I would say that that's another reason we're good at that, and that's another reason that we would encourage you to refer your pregnant clients to us so that we can take care of that part for you. So we do have relationships with CCOs. I want to talk a little bit about our funding. All OMC sites receive a small amount of funding from our office, and it varies and it depends on the number of clients seen and the type of services provided. But OMC sites do receive public health funding from something called the Federal Maternal Child and Health Block Grant, otherwise known as Title V. In addition, they receive funds sometimes through other entities. So some of our OMC sites are funded through their local CCOs to make sure that that access to prenatal care occurs. And above and beyond that, many of our OMC sites work closely with the CCOs in their community, again, to make sure that that access to prenatal care happens. So I get a lot of phone calls, and our sites get a lot of phone calls from newly pregnant women who are anxious and will say, I just found out I'm pregnant. What do I do next? And sometimes these phone calls happen, when they're 5 weeks pregnant. And what we try to do is let a pregnant woman know that being pregnant is a normal part of life, and that she doesn't have to jump into any kind of emergency mode right away. And especially if she doesn't feel like she's going to be high risk, we want to say that, getting prenatal care is important, but it doesn't have to happen at the 6-week mark. It really can happen at week 10 or 11. But in the meantime, she can start getting rest. She needs to refrain from drinking any alcohol or smoking, and she can go down to her local pharmacy and purchase some prenatal vitamins with folic acid. So our big message are these 3 points, and we do want to make sure that pregnant women know that folic acid is important. It prevents birth defects. It's very easy to obtain, and I believe when if they're on OHP, when they begin prenatal care, their provider can write them a prescription, even though it's over the counter, and OHP will cover. Am I correct there, Jessica? Do you know that?
Oh gosh, I'm not certain. I could check on that.
I'm pretty sure OHP covers prescriptions for over-the-counter as long as that claim is submitted. So these are the 3 big points, because women will call, like I said, at week 5. Okay, I've got to start getting ready. What do? I'm pregnant, and we're like, okay, calm down. You've got a lot of time. You're good. Do these 3 points, and you're just fine. So just for y'all's knowledge, as you see pregnant women, we would appreciate you passing that information along. So I know that this is a little bit of a short presentation, but I did want to reserve some time for questions. We have 5 OMC staff, and starting at the top left is Fred King, who is our research analyst. I am in the middle, wearing the red shirt with the black jumper and blonde hair, except that's a very old, younger picture. Trong Nguyen runs our data reports and does our informatics. Kate Wilcox, who is wearing the purple vest in the short dark hair, is our maternal and child health manager, and Karina Guzman is our data and support person. She does our quality improvement. If you have questions for me or want to reach out and email me, please feel free to do that. From what I understand, the slides are going to be available. So if there are questions, I can go through and happy to read.
Yeah, let's see. We have 2 good ones to get us started. I'll just read them out to you. Does that sound good?
Yeah.
Which is, can people other than pregnant women access OMC resources? Let's start with that one.
Okay. So our focus is pregnant women. So that's who our staff is trained for. Probably a lot of the staff, as I said, we're the front door to pregnancy, and sometimes I mean that literally. So our OMC staff many times are at public health departments, and many times the OMC staff could be that receptionist at the front door who then sort of directs people and says, oh, I can get you this. So I would say that you should contact your public health department or have people walk into their public health department, and they may be able to get very similar kind of referral services.
Thank you. And then the follow-up would be, can someone help get resources on a pregnant person's behalf? I think it's a similar answer.
I would say, I've never had that question before. I would say that they should have that conversation with the OMC staff. I certainly don't want to say no. In terms of getting that prenatal care appointment, I'm trying to think in terms of HIPAA and confidentiality, what that would involve. but certainly for other resources if people wanted to know what resources they have. And that's actually another reason to also utilize 211. So again, we work pretty closely with 211.
Mm-hmm. Thank you. Let's see, are there any other questions people want to key into the question box? I have one, which is how can people best find, best refer people over? Is it just straight to the public health department? Get to know the individual OMC assisters?
You know, I know I gave you the URL, Health Oregon /OMC, but for me, I just Google Oregon MothersCare, and then I go to, there's a For Pregnant Women page, and that page will open up a long list of OMC sites.
Thank you so much.
But again, I really would like to encourage y'all, when you see pregnant women, to then talk to them, refer them to Oregon MothersCare so they can get that prenatal care appointment pretty quickly. And especially after you've helped provide them, gotten them OHP, that makes our job so much easier. And then we can get them into prenatal care pretty quickly.
That's a great point. Let's see, people are being pretty quiet today. While we're talking about pregnancy resources in general, I do want to remind everyone that pregnant clients and pregnant applicants are a high priority for the state. And we do have our ohp.pregnancy requests at dhsoha.state.or.us specialty inbox, which is just for community partners to help really expedite any of those cases that maybe got pended or are otherwise sort of stuck in limbo and are not being quickly processed, because that is a priority on par with medically urgent cases, for sure.
Thank you for saying all that.
I'll plug that too. And I'm getting a request to say that email address again, and it is on the client advocacy guide, which hopefully all of our sisters have, but it is ohp.pregnancyrequests@dhsoha.state.or.us. And let's see, we have some, go for it.
Jessica, I've just changed the view to show our website, healthoregon.org/OMC.
Let's see here. We do have a question that I do not know how to speak to as far as referrals for terminations. Is there anything you'd like to say on that?
You know what? We can do that, and we have done that. We get, and that's, we're trained to do that. We have our OMC staff receive options counseling training probably once every 2 or 3 years. That's something that's required to go through. So when someone comes to OMC for a pregnancy test, and if they are pregnant and want to terminate, we will help them get OHP, and then we will refer them for termination services. And all of our 24 sites are trained to do that. Those numbers are smaller than our client caseload numbers, but we're certainly trained and aware of that as a service.
Thank you. Let's see here. So for the people who are wanting that pregnancy request email, I have typed it into the question box, and you should be able to see it there. we are right past 2:30, so I think unless I see any questions, maybe wrap up with, I see one of our sisters has said, this is a really good resource. I had no idea this existed. I know my clients will be very excited to use this and more likely to be proactive about their health. Thanks for your time. And yeah, I can't think of summing it up any better than that. Thank you so much, Lisa. This has been fantastic.
Thank you. Thank you. Bye-bye.
Bye.